Hey everybody, this is Kevin McFarland from the Art of Emergency Nursing, and you're listening to 30 Days to Being a Badass ER Nurse. In the next 30 days, I'm going to give you some quick tips and tricks to help you be a better ER nurse. And of course, as always, it's not just me you're going to hear from. I've recruited some of my friends to give you some of their tips and tricks so they can share their knowledge as well. So don't forget to subscribe so that you catch all the episodes. And if you find one of these tips and tricks are really helpful, give me a shout out on social media and share it with your friends. Let's get into today's tip. Welcome to day 11 of the 30-day challenge, 30 days to being a badass nurse. Today's episode is going to be just a little bit different. This tip may not make you a better nurse, but it just make you a better person. It'll help you understand something that you may or may not understand. Today is Veterans Day. Today is the day that we honor our veterans, our people who are served. And what I want to make sure that you know is you know the difference between Veterans Day and Memorial Day, because there's a big difference. Not everybody knows the difference. These two holidays both recognize the importance of military service. They both honor the sacrifices made. But Veterans Day is designed for those who've served. Memorial Day is for those who've died in service. A lot of times people get those two confused, and I think it's important that you know the difference so that when you're caring for a veteran, you can thank them on the right day. Veterans are, of course, always different, like your patients, but there are some common threads that run across most of those who've served. Most who've served take a great pride in the fact that they've served and feel a kinship to others that have. Part of that is due to the military culture that makes them part of a tight-knit, cohesive group. Group achievements are valued above the individual, and the cohesive team is what really matters. These values will often continue with a veteran long after they've served. Some other common military values, besides unit cohesion, is many veterans are often fairly stoic. They're not going to necessarily let you know what kind of pain they're having or let you know what's going on inside. They're typically more concerned with those around them than they are for themselves, and oftentimes will take on a caregiver role. Oftentimes the vets may delay seeking help. They're used to that suck it up attitude where they just figure that they're just going to get over it, and oftentimes they'll try to push away the pain or push away the symptoms that are going on. Oftentimes for psychological issues, they feel like admitting those psychological issues are a sign of weakness. This, of course, can lead to tragic consequence. I want to leave you with a few do's and don'ts for when you're dealing with veterans. I'll start with some of the do's. Veterans love it when you thank them for their service. They'll often downplay it and make it sound like it was no big deal, but you know and I know what a great sacrifice they made to serve their country. Definitely keep politics out of it. Not all veterans are in one political party or the other, and oftentimes it's best to just keep politics to the side, especially when caring for people. They don't need to know your party affiliation. You don't need to know theirs. Be sure to ask what branch of service they were in. If they were in the Army, they may be used to being called soldier. If they were in the Navy, they were probably called sailor at one time. Marines always are Marines. Always and forever. Air Force oftentimes are called airmen. And the Coast Guard, they're often called Coast Guardsmen or Guardian. If you're former military, you may call them Coastie. Knowing what branch they're in will help you maybe address them down the road. When you're talking to veterans, keep in mind that they have a life outside of the military. Oftentimes their military may have been a big part of that life, but they also have an outside life as well. So you're going to ask the same questions you'd ask any patient about their family, what they did as a working man, things like that. Let veterans tell you their stories when and if they're ready to tell you. And respect their process, because it is their process. Some of the don'ts for dealing with veterans: don't ask questions about the same kind of questions you hate as an emergency nurse. What's the worst thing you've seen? Don't ask about, did your friends die? Did you see people die? Did you kill anyone? They don't want to think about their worst days any more than you do. So that's a big no-no. With that said, also don't make the assumption that every veteran has seen combat. Many don't. Oftentimes someone will go their whole career without seeing combat. That's not uncommon. Don't make assumptions about someone's military career. Remember that they are the expert in their own military career. And if you ask them questions, oftentimes they'll share, but don't make assumptions. One of the questions I like to ask veterans when I meet them is, what unit were they in? Where did they serve? What kind of cool stuff did they get to see throughout their career? And one of the most poignant questions you can ask is, how did the military service affect you? It's a great question to really open up what exactly their service had meant to them. I think overall you'll find that taking care of veterans is often a very rewarding part of your job. You know the sacrifices that they made at times, and sometimes much more sacrifice than you may ever know. I found they're oftentimes willing to talk about their military experience and enjoy talking about their military experience. But again, it's their process. Honor their process. I hope this tip helps you in taking care of veterans. I think you'll find that they're a rewarding group to take care of, and oftentimes very appreciative of any of the care that you give. As I wrap up, I'd like to send a big shout out to all the veterans who are listening to this podcast right now. Thank you for your service. Thank you for your sacrifice. Also, thank you to your families for their service and sacrifice, because we know that if you serve, they serve right along with you. I thank them for that, and I thank you for your service. Hope this tip serves you well. Have a great shift.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.